some of the safest ways of preventing HIV transmission and some cultural barriers and other things. So, but the bottom line is I'm trying to dig into this issue. Like, there was this research that was conducted in 2005 and 2007, which led to the implementation of these programs in various African countries. But then, do you think that there's been another follow-up research after the implementation of these programs?
There's no need for follow-up research, in my view. The research that was done in 3 countries yielded results using the best methodology available today to science, a randomized controlled trial, which gives the strongest evidence possible. And all the 3 research projects showed that male circumcision on its own is more effective than most vaccines. And it's probably, even if a vaccine for HIV was found today, male circumcision would probably be the most preferred thing. It has an efficacy in excess of 60%. In other words, if you vaccinated 100 people, 60% of them would be protected by that one-time procedure. And most vaccines, as you know, require several injections, several painful injections. But male circumcision occurs only once. But let me tell you, male circumcision aims at preventing HIV. There are perhaps 3 main drivers to the HIV epidemic in Africa. One of them is the absence of male circumcision. In countries where every male is circumcised, the HIV prevalence has never gone above 5 or 6%. Even if you are to compare people with exactly the same behavior. So, lack of male circumcision is a big driver. The reason why HIV prevalence is highest in Southern Africa is because it's the only part of the continent where male circumcision rates are the lowest on the continent. If you were to look within South Africa and look at pockets of populations where male circumcision is practiced, HIV prevalence is extremely low, especially among, say, the Muslim communities. So lack of male circumcision is one of the big drivers. The second big driver of the epidemic is what is called MCP, or multiple concurrent sexual partnerships. A situation where both males and females have sex with more than one partner at the same time or during the same period. But if you compare the behavior change needed to change that on a permanent basis, it is huge. Nothing as close as what you might get in terms of efficacy as what you might get with male circumcision. The third method of prevention, where we have evidence that it works, is where you are able to test people in the community, identify those who are infected, and treat them with antiretroviral drugs. If you treated them to such an extent that the viral levels in their blood was very low, then those people are not likely to spread the virus. Mm-hmm. They will almost behave like people without the virus. So you control the epidemic. But what does that require? It requires absolute adherence to the treatment. It requires that their behavior changes to such a degree that they take multiple drugs every day for the rest of their life. Now, if you are to compare the behavior change required for that, for treatment to work well, and the behavior change required for people to change from having multiple partners sexually. It is huge. Yet, for male circumcision, you do one small, safe, non-dangerous procedure once. And the effects of that last a lifetime. And there are a lot of spin-offs to that as well. It's because male circumcision doesn't just address the issues of HIV alone. Not only is it hygienic, it also reduces the risk of cancer of the penis. Cancer of the penis is a problem that occurs in men. And the only treatment for cancer of the penis is to cut off the penis completely. And it's not the kind of treatment that people would like to have. In fact, one of the patients I saw when I was a young doctor preferred rather to die with it rather than have it cut off. Mm-hmm. The cancer of the penis, you may say, well, it's not so common, but it is common enough. The other thing that male circumcision does prevent is cancer of the cervix in women. Because the virus that causes cancer of the cervix in women is less transmissible after you remove the foreskin. And so it appears like the foreskin doesn't serve any useful purpose. On the other hand, it doesn't. So lack of the foreskin, therefore, doesn't confer any dangers, and the foreskin itself doesn't confer any benefits. If anything, it is something that has a lot of health hazards, not only to the person with the foreskin, in terms of cancer of the penis and the ability to spread the virus, but also to the sexual partner in terms of prevention of sexually transmitted diseases, especially the human papillomavirus, which causes cancer of the cervix in young women. Cancer of the cervix is fatal if it's not treated.
Yeah, can I pose a question there? So there are some circumcised men who we believe that are saying they're now immune to HIV/AIDS, so they're not practicing any safe sex. What can you think about it? What can you say?
It's a question of education. And I think that male circumcision, where it is practiced, needs also to be accompanied with appropriate health education. That whereas the risk is reduced, it is not 100%. And therefore, male circumcision needs to go along with the other behavioral changes that we know work in preventing HIV transmission, such as use of condoms, such as monogamous relationships, and so on.
But do you think that this male circumcision is actually working properly in most of these countries? Briefly.
I have absolutely no reason to doubt that it is working well. It has been done, for example, in Kenya, around the lake region in Kisumu. But this, in Kisumu, it's interesting because within the Kenyan population, that is one area where traditionally the men never circumcised. And the HIV rates in that population were as high as those in Southern Africa. And the men were dying, and the men were infecting the women, and the women were dying. And the women were infecting the children, and the children were dying. And the community elders got together and said, we have to do something about this. And so the drive to have the males circumcised was not imposed by the Ministry of Health or any other organization. It came from within. And they made the decision that all their boys must be circumcised. And if you look at all the male circumcision programs in East Africa, the most successful one is that one. And it has worked so well that people are beginning to see evidence of its efficacy in that area with lower prevalence rates of HIV.
Now, in cases where these males that are circumcised are actually indulging in unsafe sex, what is the way forward? What do you think should be done?
Like I said, it is it's important that they must be educated prior to and after male circumcision. But after being circumcised, if 100 males who are circumcised were to indulge that way, and 100 males who are circumcised were to indulge that way, the uncircumcised one will still cause more problems. And therefore, I would still say that it is one solution that we know works. We knew even before these studies that were done to prove it that it works were carried out, we knew that it worked from epidemiological studies. For example, we knew that cancer of the cervix was extremely rare among Jewish people. Jewish people circumcised 100%. And we knew that looking at populations within Africa, like north of the Sahara, where the majority are Muslim, the prevalence rates are extremely low. And in the sub-Saharan African region, comparing populations where male circumcision was high to those areas where male circumcision was low, the differences were humongous. So we knew that already, but we needed proof. And the proof was produced when they carried out these 3 randomized controlled trials, which showed beyond doubt that male circumcision works, and it works well.
Doctor, thank you so much for the interview.
Thank you.
And stay well. Thank you so much.